And finally, Dr. Amy West, who will be presenting Walking Through the Bush with a Stone in Your Shoe, How Social Media Helped Me Find the Cure for Back Pain. Please welcome Dr. West.
Thanks everyone for sticking around. Another 10 minutes before you are out of here, so I appreciate you all sticking around. I used to be a television producer in my former life, and I'm used to sort of being behind the scenes and telling stories, so this center stage stuff is kind of new for me, so we'll see how it goes. Back pain, let's talk about it. Who here has ever treated back pain? Show of hands, yeah, right? And I can hear the groans as we talk about it. Back pain, as we know, it's the leading cause of disability worldwide. We spend billions of dollars every year on back pain, and now the prevalence continues to rise, and the money we spend on back pain continues to rise. And what if I told you that social media actually helped me find the cure for back pain? And social media, it's becoming increasingly popular within the medical world. It allows people from across the world to communicate, people with similar interests to share ideas and ideas about treatment plans. And actually this year at our conference, you were able to designate yourself as a social media user with this I Tweet ribbon. So that's kind of a new interesting thing that's popped up. And so my story, essentially, it starts with a hashtag. And for those of you who don't know what a hashtag is, on Twitter, a hashtag designates a topic that people are talking about, and it allows you to link your comment with other people's comments all over the world. And I saw this hashtag, and I said to myself, what does that mean? I'm a rehab specialist, and I want to know what this whole failed rehab syndrome is all about. So I started searching on the internet and fiddling around on social media, as probably some of you are doing right now on your phones. And it led me to this guy. And this guy, his name is David Johnson, and he wears many hats. And one of the things that he's a neurosurgeon. He's Australian. He's a fitness enthusiast. And he is the person who coined the term failed rehab syndrome. And he coined this term after he had starting to receive many referrals of patients who had had chronic axial low back pain, who had had many rounds of physical therapy, injections, medications, et cetera, and even surgeries. And they started presenting to his clinic. And he's developed a really interesting way of treating these patients. And instead of taking them to the ORs, he takes them to the gym. And it's actually quite easy for him to do, because in his hospital, St. Andrew's War Memorial Hospital in Brisbane, Australia, they have built him his own fitness facility within the walls of the hospital, which is pretty cool. And what he does there, during the day he operates, and in the evenings he coaches. And I thought this was really cool as someone who's into fitness myself. And I started searching online to find out more about this guy. And I looked at on YouTube, I tried to find out more. I listened to some of his lectures online, and I thought they were really interesting. And then I started the process of what is known as Facebook stalking. I don't know if you guys are familiar with that, but I started searching around to try to find out more about this guy. And I found his facility on Facebook, which is called the Functional Movement Training Center. And I saw this little thing here, and I sent him a message. And I said, hi, I'm a physiatrist. You probably don't know what that is. But I treat back pain. I know a lot of people who treat back pain. Let's talk about it. And he responded right away. And this pretty much started off over a year and a half of correspondence. And we were essentially back pain pen pals, where we would share ideas about back pain and ideas of sort of what we think are the best treatment plans. And after talking with him for over a year and a half, I said, I have to share our conversations with my physiatry colleagues back in the States. So, and how we treat back pain here, the usual, someone comes to our clinic, they have back pain, and we say, okay, we'll try PT, maybe some injections, some medication. And then if that doesn't seem to really work, so maybe we'll get some imaging, it probably won't show much, and sure enough, it usually shows some degeneration. And we say, okay, well, let's go back to one of these things that maybe the other one didn't work, and we'll try a different thing. And then eventually, maybe, sometimes they end up in a surgeon's office, and maybe a surgeon will operate on them, and usually that doesn't work. And then they start cycling over again, and this is failed rehab syndrome. This is what David Johnson was describing, and this is what we see in our clinics all the time, people with axial back pain who sort of are in this pain cycle that's pretty much never ending. And we as physiatrists are kind of square in the middle of that. And what David and I have talked about, and something that we strongly believe, is that all of these treatments and this cycle basically exists because all of our treatments target a downstream effect of what the actual true cause is. And because we're not targeting the actual cause, we're never going to be able to cure the disease. And what we have discussed as what we believe to be the true cause is movement dysfunction. People moving poorly through life. This leads to degeneration. And this is one of the reasons why even surgery is not curative in many cases, because you fix a spine, but if someone continues to move poorly on that fixed spine, it will eventually degenerate again, and they'll have pain again. So, how does movement dysfunction happen? So movement dysfunction happens when our body forgets how to properly perform functional movements. And what's a functional movement? Functional movement is something we're born knowing how to do, something that no one ever teaches us how to do, and that we do many times a day without even realizing it. So birds fly. You don't see a bird in the sky with one forgetting how to flap its wing going in circles, right? Babies squat perfectly. They have perfect squat form, actually. And no one teaches them how to do that. And when was the last time one of you got your butt below your knees like that, right? So babies do this perfectly. And over time, society essentially puts us in cages. We sit all day. We sit at the office. We sit in our cars. We sit on the couch. And our body essentially loses the agility, the coordination, the neuromuscular control to correctly perform these functional movements. And functional movements, if you got up out of a chair today, if you got up off the toilet today, if you put your pants on today, you did a squat. And imagine doing that many times incorrectly, and over time, this leads to degeneration in the spine. So in order to well, the good news is that we can re-educate our bodies to learn how to perform functional movements correctly again. But in order to do that, it really involves a paradigm shift in how we think and treat back pain. And we have to start thinking of back pain as a central nervous system movement disorder rather than a musculoskeletal one. Our rehabilitation of back pain must be more akin to how we rehabilitate a stroke. Someone who presents with hemiplegia, we don't tell them, strengthen that hemiplegic arm, it'll work again. We have to retrain the central nervous system in order to rehabilitate them, and back pain is no different. So David Johnson, down in Australia, has developed this system of what he calls movement therapy, which is more focused on the central nervous system rather than traditional PT, which is more MSK focused. And it involves these 5 principles, which I don't have the time to get into today, but it involves these 5 principles. And as you can see this is inside his training facility, and there's people of all ages, all body shapes and sizes. And the goal really of his therapy is to give patients the skills, to have them acquire new skills so that they can function in everyday life, rather than just making them stronger. And what you will not see in his gym, stuff like this, contraptions, right? If you're going to rehabilitate the central nervous system, if you're going to retrain agility, coordination, neuromuscular control, you can't do that by using a machine that doesn't require you have any of those skills in order to use it. Another thing you won't see are tables. And one of his quotes in his lectures is, the first thing someone does when you walk into a physical therapy gym is lay you down on a table. They're doing you a disservice. Our therapy sessions should be targeted on an active recovery, just like how we now do in concussion. There's really been a paradigm shift in that over the past 10 years, and it's all about active recovery. And another thing you won't hear is core strengthening. So and we've all had patients, athletes with strong cores who present and say, well, I have back pain. What are you going to tell them to do? And the idea here is that it's not about the muscles you have, but it's about how you use them. And this brings me to the title of my talk, and one of the analogies that David uses in one of his talks, he says the movement therapy and physical therapy sort of two different ways to look at the same problem. And it's like walking through a bush with a stone in your shoe. And a bush is Australian for woods, I suppose. We don't really have bush in Boston, but so it's walking through a bush with a stone in your shoe, and say you walk for many miles with this stone in your shoe and you develop knee pain. And if you were to go to a more traditional physical therapy program, they'd say, okay, let's massage your knee, let's stretch your hamstrings, let's strengthen the muscles around the knee, we'll see how you do. Whereas this movement therapy idea is more, let's work on getting that stone out of your shoe. Let's get to the root cause of your problem, so this way it will go away for good. And you say, okay, well that sounds great, but does it work? So right now, Dr. Johnson continues to collect data, and he's had over 150 patients go through his 8-week program. He's had an average reduction of 50% on the Oswestry Low Back Disability Index, which many of you are familiar with. And on this survey, actual 10% reduction is considered significant. And one of these patients is this lady. This is Joyce. Joyce is an octogenarian who finished his program and was actually able to make the trip from Australia to Las Vegas and to do this. So she's living her best life, and she's moving a lot better than she's ever moved, probably. So back to my story. David Johnson and I, after a year and a half of corresponding via email, we actually met in person for the first time this summer at this year's CrossFit Games, where we were both spectators. And it was really nice to finally see him face to face and talk about our ideas. And in fact, we spent very little time watching the games. We were in the corner the whole time talking about back pain and being big nerds about it. So, but it was really nice to actually meet him. And he's actually invited me to Australia to come to see his facility and to study more about his methods. And my trip to Australia, I really have to thank to Twitter. So social media can be a pretty powerful tool. And if you yourself are interested in learning more about this, the AAP is very graciously flying him up from Australia to be at our AAP conference in Puerto Rico. He and I, along with a colleague at Spalding, will be giving a course about his methods. He'll be bringing a movement therapist from his program, and we'll be talking about how you can incorporate movement therapy into your clinic. And you can follow us. I'm Amy West, MD, on Instagram and Twitter. He's Libretto73. If you want to come join the conversation, or sometimes people want to argue with us too, we're happy to just have a dialogue about this. Thank you very much.
Thank you. Thank you, Dr. West.